met, I know I've met the folks that are in the room. I think I probably have met a few of the folks that are on the phone. But today I'm just going to go over your benefits that are going to be offered for the upcoming plan year, what you guys need to do, the changes that are taking place, and then answer any questions that you may have. So, Employee Navigator is open. It opened this morning. Everybody should have gotten the email invite to log in and get started. If you have not, or if you're having challenges, get with Jody or Nathan and they
Mhm.
can make sure that we get it taken care of and resolved. It will be open until June 16th at midnight. It's going to close at that time. So from there, you're not going to be able to make changes. So if you are making changes, electing new benefits, any of that, please make sure that you get in there before midnight on the 16th. Just as a refresher, open enrollment is the only time during the year that you do have the ability to make changes to your benefits. Outside of that, your benefits are locked in from July 1st until the upcoming end of June. And the only time that you would be able to make a change during that time period is if you experience a qualified change of status. Examples of those are going to be you get married, you get divorced, you have a baby, maybe you have a child who turns 26, you need to take them off of your plan. Any of those things are qualified events that are going to allow you to make a change to your benefits. But in order to do so, you need to get with Jody or Nathan within 30 days of that event to make that change. And I already went through this. I'm getting ahead of myself. Um, Already talked about qualified change of status. So the big question usually is what's changing? So minimal changes to the plans this year. The tier one deductible for the HSA 3300 plan is being adjusted. This is an IRS requirement. So anytime you have a high deductible health plan that is paired with a health savings account, you have to meet certain minimum deductibles. So the HSA 3300 deductibles are being increased slightly in order to keep your plan compliant from an HSA standpoint. Also, the HSA contribution that the county makes to anyone that is taking that plan is being increased. The HSA maximum elections, so the amount that you can put into your HSA account is also going up. This is another thing that is reviewed annually by the IRS and adjusted slightly. So each year you usually see that go up 50 to $100. We do have a new voluntary offering this year, so it's through Mutual of Omaha. It's a hospital indemnity plan. We'll talk a little bit about what that is and answer any questions that you may have, and then slight changes to your contributions. So we'll go over those as well. So jumping in, you guys still have the three plan offerings, the point of service or PPO 250, the 2000 plan, and then the HSA 3300. Just as a quick reminder, each plan has a single and a family deductible. You guys have three tiers of coverage. So you have that enhanced tier through Mackenzie, where you get little or no cost when you utilize Mackenzie providers. Then you have your in-network tier of coverage, and these are going to be Aetna providers. So if you are, I'm sorry, these are Cofinity providers. So if you are utilizing one of those providers, then you are going to have the in-network cost sharing that applies. And then you have the option to go out of network. When you utilize an out of network provider, you're going to have significantly higher costs. So your deductibles are higher, your out of pocket maximums are higher, and the provider basically has the ability to balance bill, which means they can charge you whatever they want. When you're utilizing Mackenzie or a tier one or an in-network provider, they've agreed to accept a lower amount as payment in full. So you know that you are getting a lower cost when you're utilizing one of those two. So when we look at the bare minimum, so looking at just tier one and in network compared between the three plans, Looking at the point of service 250, if you're going to a Mackenzie or a tier 1, we're just gonna refer to this as tier 1 benefit, you have no deductible. In network, you have a 250 single, $500 family. Under the 2000 plan, if you're utilizing a Mackenzie provider, that deductible is 1,000 for single, 2,000 for family. In network is double. And then under the HSA plan, you have a 1650 single, 3,300 family deductible if you're utilizing tier 1. And then for in-network, you've got your 3,300 single, 6,600 family. Once you've met your deductible, coinsurance kicks in. Coinsurance is the split between what you're paying and what the plan is paying. So on both the 250 and the 2000 plan, you have an 80-20 split, meaning the plan is picking up 80%, you're picking up 20. And under the HSA plan, the plan is covering 100%. So basically with that plan, you meet your deductible and then most services are going to be covered at 100%. There are a couple of things that have co-pays, but for the most part, everything's going to be covered at 100%. Under the first two plans, you have a coinsurance maximum. So a coinsurance maximum is basically if I have services, I have nothing that has a copay associated with it. I just have things that are going towards coinsurance. These are going to be things like hospital visits, high cost imaging, I'm getting an MRI or a PET scan, things of that nature. If I have met under either of these plans, $500 as a single or $1,000 as a family, I don't have any more coinsurance that's gonna apply. My copays are still gonna apply, but my coinsurance is capped. I have an out-of-pocket maximum on all 3 of the plans. For the 250 and the 2000 plans, that out-of-pocket maximum is the same. It's 7,350 as a single, 14,700 as a family. Under the HSA plan, it's 6,650 as a single or 13,300 as a family. Think of this as a big safety net. Most people are never going to meet the out of pocket maximum. It's not designed for everyone to meet it. It's there to protect you from basically bankrupted due to healthcare expenses. And I'll give an example. Let's say that you're enrolled in the 2000 plan. So you've got and we'll say you're utilizing a network provider. So you've got a $2,000 single deductible. We'll say I'm a single individual. So I'm enrolled in the single coverage. I go and I have a $500,000 surgery and then I'm taking 6 or 7 medications associated with that. None of them are $350 or more, so they're not going through sharks, so I'm paying copays on those. If I'm paying my coinsurance and I continue to have all of those copays, you could easily meet, $10, $15,000 out of your pocket in costs. So what this does is it caps that off. So if during the course of the year, again, we'll stick to the 2000 plan. If I'm enrolled in single coverage under that 2000 plan and I meet out of pocket my deductible, my coinsurance, and any copays for medical, prescription, imaging, any of that, if I hit 7,350 in all of those expenses, the plan is going to pay at 100% for the rest of the year. So that really is, again, it's a safety net put in place to protect you from having just a financial catastrophe. And again, if you looked at the HSA 3300, um, and, again, this could easily, any of these, you could easily be bankrupted. And that example I gave of the $500,000 surgery, unfortunately, those are becoming more and more common. Um, it's more common for people to be on, multiple medications that have very high copays that cost a lot. So Again, that's really just a layer put in place to protect you guys. All of your preventive care when you're utilizing a McKenzie provider or you're utilizing any in-network providers is covered at 100%. You don't need to meet a deductible. There's no copays. These are going to be things like your age-appropriate mammograms, PSA tests, immunizations, well child visits. These are things that are extremely important, and any of you that have sat through a presentation with me in the past have probably heard me someone said harp on this, um, but I'm gonna harp on it. Preventive care, I think we all tend to be really good when it comes to taking care of our kids, making sure they're getting in for those well child visits. But when it comes to ourselves, it's easy to just kind of say, well, I don't have the time. I'm going to put that off. I'll get to it in a couple months. And then a couple months can turn into a year, can turn into 2 years. This is put in place with no cost sharing to you to make sure there's no barrier for you to go in and get that done. So many things can be caught, serious things, before they get to an elevated condition. I'll give an example. I have an employee that specifically said to me, I have sat through 3 years of meetings with you. You harp on preventive care every single year. Every year I ignore you. I don't go get my physical. This was a man, by the way, Nathan, not picking on you, but I think men tend to fall into this category quite a bit. And he said, after the last one, I went and saw my doctor and I got my physical. His blood pressure was through the roof to the point that his doctor sent him immediately to the hospital because he was in the range where he could have potentially had a stroke. So thankfully, we caught that ahead of time. He was able to go on a simple blood pressure medication and can control that before it gets to that really significant life altering condition. So that's why I always sit here every year and I always stress it. And I think Jody and Nathan probably stress it as well. And at the health fair, we're going to stress it again. Is just really, it's so important. So please make sure that you guys are taking advantage of that. Your primary care physician visits, again, if you go to a McKenzie provider, it's no cost to you on the 250 and the 2000 plan. On the HSA 3300, I'm going to pause for a second on that. I'm going to focus on the other two for a quick second. So on the 250 and the 2000, your primary care with McKenzie is no cost. You have a $30 copay if you're going to an in-network provider. If you're going to see a specialist or you're having urgent care and it's being done at McKenzie, again, there's no cost to you. If you're going to an in-network provider, it's $45 for a specialist, $60 for urgent care. And then emergency room care, whether you're going to McKenzie or you're going to in-network or you're going to out of network, emergency room care under those 2 plans is always covered at a $250 copay. And the reason that that's the same under in, out, and McKenzie is we really want people to get to the emergency room as quick as possible if you're experiencing a heart attack, you think you're having a stroke. We don't want you to have to stop and say, "Hold on, I'm not close to McKenzie. I need to go into my app and try and find an emergency room that takes maritime coverage." We just want you to get there and have the best outcome possible. Now, under the HSA 3300 plan, I mentioned in the beginning of the presentation that there are IRS rules um, that kind of guide this plan. So, in order to have a plan that allows you to have a health savings account, everything except for preventive care has to go towards your deductible. So the plan is not going to pay anything until you've met your deductible. So if I'm enrolled in this plan and I go on July 5th to get a prescription filled, I'm going to pay the actual cost of that drug. I don't have a copay. If I go into the emergency room, I'm going to pay the actual cost of that service. If I go have an office visit copay with or I go have an office visit with my primary care physician, I'm going to pay the actual cost of that visit. So all of those things up until the point that I've met my deductible. Once I've met my deductible, then my cost sharing kicks in. So really under that plan, it's your copays. Because you've got 100% coinsurance under that plan. And again, that's until you've met your deductible. Something else that's important to note here, though, is that even though I'm telling you you're going to pay the full cost of that, where medical is concerned, any provider that is either Mackenzie or is an in-network provider, they've agreed to accept a reduced payment as coverage in full. So an example would be, let's say I'm going to my regular primary care physician. They're not a Mackenzie provider, so it's going to fall into that in-network tier. When I go in, maybe they normally charge $200 for an office visit, but they've agreed to accept $160 as payment in full as a part of being that in-network provider. In that situation, when I go, I'm not gonna pay anything when I'm at my doctor's office or if I'm going to the ER. I'm not gonna pay then. What's gonna happen is they're gonna bill Meritain. I'm gonna get an adjusted claim. That discount of $40 in this example is gonna be applied, and then you're gonna get an explanation of benefits or an EOB from Meritain. You're also then gonna get a bill from your doctor letting you know, again, following this example, that you owe $160. With prescriptions, that doesn't apply because where pharmacies are concerned, they don't have agreements with different insurers. They don't have agreements with different networks. They have their own agreements directly with pharmaceutical companies. So when you go, you're going to pay the cost of that prescription while you're sitting at the pharmacy. I would strongly encourage you to shop around between pharmacies. There is a huge difference in cost from one pharmacy to another. Any that have been on this call the last couple of years have heard me use this example, but it's true to life, so I always stick to it. I have 2 pharmacies directly across the street from one another. One is a, Walgreens, one is a CVS. I had gone to the Walgreens for years and years just because that's where I went when I moved out here. Never, even though I tell everybody else to shop around, I had never taken the time to shop around for my prescriptions. I'm in a high deductible health plan, so I pay the cost of my drug until I've met it, and it was about $240 a month that I was paying for that prescription until I met my deductible. One day I was like, I'm going to take my own advice. I'm going to hop online. I'm going to look and see what the cost of that drug is. Literally by driving across the street, I saved myself $35 because CVS has a different contract with the drug manufacturer that was cheaper. So do that. You can do it within the Meritain website. You can do it within the TrueRx website, which is your pharmacy benefit manager or PBM. You also can do it through HealthJoy. We'll talk about HealthJoy in a minute, but that's your concierge basically that can help you with looking up medical costs. They can help you with looking up drug costs. They can help you find care. They can help you book appointments with providers. If you've got a billing issue, they can help with that. But all of that to say, take the time to look that up. If you guys have, I don't think you have a Costco near you, right? You guys are more okay. So I
No.
won't give that example. But definitely take the time. Sometimes Walmarts are less expensive, sometimes Meijer. So you can basically go in, put the name of your drug, the dosage that you're taking, how many times a day you're taking that drug, and your zip code. And then it'll ask you how far you're willing to drive. So if you put like 10 miles, for example, it'll pull up a listing of all the pharmacies and what that particular drug costs at each of those. So definitely take advantage of that. And even if you're in one of the other plans that just have a flat copay, if you're in the 250 or the 2000, remember any of the costs, everything medical and prescription that you guys encounter is actually paid by the county. So all of those claims go towards the overall cost of your plan, which then dictates what you guys pay in contributions, right? If you guys have a great year as far as claims go, then you have a higher chance of having lower contributions, maybe having some additional enhancements added to your plan. So, everybody taking the time to make sure that you're going to a pharmacy that has the lowest cost is going to help save all of you in the long run because those plan costs impact everybody that's enrolled in the plan. So under your 3 plans, again, we've gone over the HSA, everything goes towards your deductible. But then on the 250 and the 2000 plan with those, again, you've got flat copays. So your tier 2 are going to be your generics. This actually should say tier 1. I apologize for that. We'll get it corrected. So your tier 1 is generic drugs. These have a $15 copay. Your preferred brand are tier 2. These have a $30 copay. And then you have a preferred brand or non-preferred brand, which is tier 3, and this is $60. So generics are chemically equivalent to any brand name drug, but they have different fillers in them. So if I'm taking Synthroid, for example, which is a thyroid medication, the drug may be a small round yellow pill. When I go to the pharmacy to get the generic version of that, it may be a oblong blue pill. Chemically, it still has to be identical, but those fillers, the color, the outside coating, those can be a little different. So they can look a little bit different, but they are going to save significant dollars. Sometimes a brand drug will be, well, in the example that I gave, Synthroid, that is about $185 a month for a regular average supply. You can get the generic version of that. I think it's about $17.50. So big difference in cost. Your preferred brand and non-preferred brand. So these are those drugs that either you're choosing not to fill on a generic, basis, or they just don't have a generic available at this time. Those are categorized into preferred and non-preferred based on cost and efficacy. So if there's another medication that's available in a brand name that's less expensive, that's going to fall into tier 2, and then your higher costs are going to fall into tier 3. Any medication that is $350 or more has to go through Sharks. Sharks is the specialty drug and high cost drug concierge, if you will, that handles anything that exceeds that cost. And what Sharks does is look at things like manufacturer's assistance programs, patient assistance programs, or international shipping. So if you are on a drug, we'll give an example of Humira. Humira, the last time I checked, is about $8,400 a month. And you guys all heard that right. $8,400 a month.
Holy.
Yeah. Oh, and we have some that are significantly higher than that. There's a cancer drug, on average, I think it's about $37,000 a month. We want you guys to still get those medications, obviously, but we want to do it in the most cost efficient way to the plan. So again, what is going to happen is let's say you get a prescription for one of these medications. You're going to go to the pharmacy the first time, you're going to get it filled there, you're going to have your standard copay, and then Sharks is going to get a notification from TrueRx saying, "Hey, April's taking this medication. It's more than $350. Please source it for us." They're then going to reach out to me. They're going to say, "We need you to fill out this form that gives us access to your medical information, and we need some basic financial information from you." I'm going to have an advocate assigned to me, and that advocate is then going to work to see if I qualify for a MAP or a PAP, which is manufacturer's assistance or patient assistance. If I do, that drug is free to the plan and free to you. So you have no cost and the county has no cost. So in the instance or the example of that $37,000 a month drug, that's money that is not hitting the plan and it is not coming out of your pocket. So that drug is free. If for some reason there isn't a map or a path available, or let's say I just make an excessive amount of money, so I don't qualify for one of those programs, then they're going to source that drug internationally. And 99% of the time, that's coming in from Canada. These are medications that have to meet the same strict FDA guidelines. They are exactly the same as what you would get in the US. However, those drugs cost about 50% less in Canada than they do here. So they're then going to source that drug internationally. That 50% cost is going to go towards the plan. So the county's going to pick that up in claims. That medication is still free to you. So any medication that you are getting through Sharks, even if you're on the HSA plan, you don't pay a penny for. So very important. That process can take about 2 weeks. I've seen it on the longest side, probably 3 weeks. So that's why you're able to get that fill at the pharmacy while you're waiting to get that. Once it's approved, that medication is shipped to you. You get a 3-month supply shipped directly to your home. Again, no cost to you. And then every time the 3-month is about to come up, you're going to get a text if you've signed up for it. If not, an email from your Sharks advocate that says, "Hey, April, your refill's about to be due. Can you please just go in, check the box saying that you're still on this medication, that nothing has changed?" And then they automatically handle that and ship it to your home again. So, a really, really, really great program. If for some reason, in the very rare instance that that medication can't be sourced through a manufacturer assistance, patient assistance, or internationally, then it's going to come back through the plan and you would just have your normal cost sharing. That is extremely rare. I've seen one that has come through, one prescription that has ever come through on any of my clients in that situation. Outside of that, it's always able to be sourced, outside of that. I'm gonna pause for a second because 'cause I've gone over a lot with, the medical and the prescription, so I wanna ask if there are any questions so far.
I have a couple, April.
Okay,
I'm Trudy from the Treasurer's Office. Thank you for this today. The partnering we have done with Mackenzie has been phenomenal. I have lowered all the costs that I have had, but what I'm wondering is, did that partnering help to reduce our cost of claims this year? Did
it
it?
did.
Okay, it
It did
did.
significantly, yeah, and I'm gonna have a handout, at the health fair, just kinda giving some high-level stats on that. It reduced your cost significantly. So, they're giving a discount on claims, so anyone that has a service there, they're charging less to the county than if you went to an in-network provider. So, it's a win-win on both sides. And the
Yeah.
goal is to try and expand that even further as they are working with like adding some MRI and some additional imaging. The goal is to try and expand that partnership so you guys have some opportunities for saving there as well. That's a great question.
And when I go in there, they'll say, we'll even drop your rate 20% if you pay us today for your copay. And I was always wondering if I should be doing that or let them bill my insurance first. But I think the last time, by the time I got my EOB from the insurance, the cost aligned, my share aligned with what I had already paid them.
Yep. Yeah, they do that. So how it works, and that's another really nice thing that they're doing with you guys. And sometimes other providers will do that, but Mackenzie has been really good. So if you go in and they say, we'll cut your costs by 20% if you pay in full now, what they're billing then to Meritain is that lower 20% reduced amount. So that is a good point. And not every single service is going to fall under that, but a lot of the bigger services, they'll usually offer that. So if you're having a surgery or you're having some imaging, things of that nature.
Good, thank you.
You're welcome.
In April, I think, for the sake of, for anybody, I know we've got a small group here today, but anybody that watches the video later, I think, what Trudy just asked is a very good point for people to know. The partnership with Mackenzie has been positive. It's helped to reduce costs. Some of the other things put in place, I know creates sometimes an extra step for employees, like the Sharks program with those high cost, drugs. But in working with you guys, that's another thing that, I appreciate you guys have put in place, which has greatly, I think, helped to reduce our claims costs. So those are things for employees to know. You guys have worked hard to try to create some strategies with us to, mitigate costs, and some things might create an extra step for employees. But what it does on the back end, I mean, seeing a reduction for people in healthcare costs, I've talked to a couple people and they're shocked that we saw a reduction for employees in costs. Like, and personally, I didn't even know if it was possible to get a reduction. I always said if we were able to stay flat, I think that would be a phenomenal year. So, appreciate everything you guys have done. Appreciate employees taking the extra step to participate in those things. It's really a group effort. We all have to work together to try to keep costs down. So.
Agree. Yeah, I will say I have two clients that were able to remain flat from a cost standpoint. You guys are the only one that has been able to have a reduction this year. And so it is attributed to the plan designs that you guys have in place and also from an employee standpoint. You guys you're being smart healthcare consumers. Um, and that it says a lot. And it is like with sharks, for example, it can be, if it's your first time doing it, it can be a little frustrating, but the fact that you're getting that medication for free and we're keeping that cost off the plan, and the $37,000 drug example is not unfortunately uncommon. There are a lot of drugs. And I have a client who has a child that is on a drug that's over $50,000 a month, and we're able to run that through Sharks. They get that drug for free. That's $50,000 a month in savings. So, the half hour that it may take you to fill out the form your first time, and then the 5 minutes every 3 months to go in and check the box may seem irritating. But keep in mind that's impacting what you pay out of your check, and then also your ability to have a really, really good plan. You guys have a lot of enhancements, a lot of things that other groups don't have. So thank you, Nathan. That's a
Yeah.
Now, April, with the sharks one, like I know a drug like Eliquis it can be very expensive. Also, would it be like going on the manufacturer's like website and kind of getting like a coupon card? Cause like for that one, I know you can get, you fill out a couple questions and like a form for that one.
Yes,
Is
so you
what sharks
don't
kind of
have
is.
to do any of that. So when you talk to Sharks, that's where they're taking that information from you.
Got it. So they do the
Um,
same thing, but they just do it for you.
yep, they do it for you. And it's very rare that we see a copay card that becomes applied. For the manufacturer and patient assistance programs, they're looking to see if there's a program where it doesn't cost the company at all. Because the thing with those copay cards, you get a reduced cost. It's usually like 20 or $25, but the cost of that drug, the full cost is still running through the plan. So the county is still paying the cost of
Got
that.
it.
The plans they're looking at are plans that have no cost. So, um, and people usually recoil a bit when I say they're income based because the income level is relatively high for what you can make and still qualify for one of those plans. But yeah, that's what they're doing. And that's why it can take a couple weeks. They're looking at those MAP and PAP plans. And if you don't qualify, there are some individual foundations for like specific drugs. They look to see if there's funding there. And then if it's not, then they go international. And it's nice too, like, I personally had a drug that went through this recently. And it was almost annoying how many texts I got, but I got a text that let me know, okay, it's shipped from, because it came from Canada. Then I got a text that said it's in customs. I got another text that said, okay, it's cleared customs. Then I got one that said it's in California. It's now headed your way. So I knew exactly every step of the way. And then I knew, okay, it should be on my doorstep when I get home today. Um, so it's very clear communication, but it is, probably it may not even take you a half hour. It may be 15 to 20 minutes the first time. You just need to go in and fill out that form, and then you're all set. What I will say is I like to remind people this is mandatory. So if you have a drug that falls into this category, you get it filled at the pharmacy. You get up to 2 grace fills, again, to cover that time frame while they're sourcing it. If you refuse to engage with sharks, so you don't go in, you don't fill out that form, they don't have the ability to source it for you, when it comes time for that third fill, you have no more coverage for that medication. So you're going to get emails, you're going to get letters, you're going to get phone calls from sharks saying, "Hey, we need to get this set up." So I would say if anybody is getting that, please make sure that you're engaging. And you don't even have to wait. So I mentioned I'm on a high cost or a high deductible health plan. That drug that I referenced that I personally went through is $750 a month. So for me to go to the pharmacy and pay $750 while I'm waiting for them to source it, I'm not going to take that drug. So I actually called Sharks. I didn't wait for the whole process. I called them right away as soon as I found out what the cost was and said, "Hey, can you get this started? Because I can't afford to go pick it up at the pharmacy." I had the ability to wait a couple weeks. I didn't need it immediately. If you do need it immediately too, keep in mind a lot of times doctors will have samples for some of those higher cost medications that can get you through a couple of weeks as well while you're waiting. So again, really, really great program. And then popping back up to the True RX piece. So if you're not taking one of those high cost meds that fall into that category, but you're on a long-term maintenance medication, so blood pressure meds, cholesterol meds, thyroid, anything other than like a short-term dose, you can get a 90-day supply through mail order. This is local mail order. Um, for 2 copays. So instead of going to the pharmacy every month, having to pay your copay, let's say it's a tier 2 medication and you're on either of the 250 or the 2000, you can save yourself $30 and it's shipped to your home. Again, similar fashion, you won't get all the updates. It'll just show up on your doorstep. But you put your credit card or your debit card info in and they'll automatically bill you when it's time for your refill and it'll just show up on your doorstep. So that's another good savings opportunity for anybody that is taking a tier 1, 2, or 3 medication.
And I just want to add to that, April. I think, for employees to know the reason that like Sharks was mandatory and we had talked about it, we weren't doing that to try to make things difficult in any way, but what it does to mitigate costs. And it's not that difficult of a process. And again, it's the savings for the people, but it's the overall savings it creates for the plan too. So again, we're all kind of working together to try to mitigate costs. So we felt in talking to you guys that having people take this step, the effect it can have on the back end with the costs at renewal is worth it to make that mandatory. So
Yeah, and I'm trying to remember, and I could give this specific number, but I want to say last year you guys had about $170,000 in savings from that plan alone. So that's a big impact on what you guys again are paying out of your pocket because we're able to keep the costs down for the county. And I may be even on the low side when I'm quoting that. I'm trying to remember offhand. All right. So we got about what do we got? About 17 minutes left. So I'm going to go through the rest of this relatively quickly. Health Joy is, I mentioned this briefly on one of the other slides. So Health Joy is kind of like a concierge that's available to assist you guys for anything healthcare related. So this is going to be your medical and your pharmacy. So if you are taking a medication and you want to find out what's the best cost, what's the best pharmacy, you can do one of the things that I mentioned, go into Meritain, go into TrueRx and look it up. Or you can call or text HealthJoy and they'll actually do it for you. So it's really convenient. If you get a medical bill and you're not sure if it looks right and you don't want to spend the time on the phone with Meritain, you can go into the HealthJoy app, let them know, take a picture of the bill, and they'll do the research for you. If you're not sure where you're at with your deductible, I do this, I'm guilty. I know you guys' plan inside and out. I don't know my own. And I'm a bit lazy when it comes to going into the website. I'll pull out my HealthJoy app and message them, "Can you tell me where I'm at on my deductible? How much have I met so far for the year?" They'll look it up and actually respond back to me. So it's a really great source of support for you guys. If you have just a question, is this covered? Is it not covered? They can help with things like that too. So anybody that has a smartphone, please download the HealthJoy app. There's instructions in your benefit guide, or you can get with Jody or Nathan. If you don't have a smartphone for any reason, you can do it from your computer or you can call. So it's a great resource. Anyone that takes one of the three plans, the three medical plans, this is provided to you at no cost. So, and it's available 24 hours a day. So if you're up at 3 in the morning and you want to know if a provider is in network, you can message them, or you want some assistance on a prescription, you can do that as well. Anything from a complex care and second opinion standpoint is going to run through Edison. This is voluntary, so you don't have to use Edison Healthcare. However, this is a really great benefit. So, for things like spinal surgeries, serious orthopedic, cancer, heart, transplant, bariatric, any of those types of things, you can utilize Edison Health and there's no cost to you. The exception to that is on the HSA plan, your 3,300 plan, because this is healthcare, you still would have to meet your deductible. But then, other than that, the plan is going to be free. And Edison utilizes the top smart care centers in the United States, places that you think of like Mayo Clinic, Cleveland, I can't speak today, Cancer Clinic. These are the places, John Hopkins, that are participating with Edison. And how this works is, let's say someone needs to have a spinal surgery. The first thing you're going to do is call Edison. They're again going to have you fill out a HIPAA form. They're going to get your medical records. Those medical records are going to go to an independent board, not paid to have someone get a surgery, not paid to steer you away from having surgery. They're not connected to your plan at all. It's an independent review board of physicians. They're going to look at it and they're going to say, yep, we think you should have this, or no, we think maybe aggressive physical therapy is a better course of treatment. But let's say it's the first. Let's say they say, yep, and I'm not going to use myself because I feel creeped out by this. Let's say John needs to have the spinal surgery. They say, yep, you need to have it. They're then going to coordinate with the best smart care center in the United States to get that scheduled. They're going to have it fast tracked. So it's not a situation where you're waiting 7 months to have a spinal surgery. You're going to be going usually within a couple of weeks. They're going to pay for transportation for you and a companion. They're going to pay for rental car, airfare, hotel lodging, all of that. When you get there, it is white glove treatment. There's someone there that is going to walk you back to the area that you need to go to. You're going to have all of your care taken care of. Then, when you're done, they're going to again coordinate your transportation back, and then your care, your follow up care is going to transfer back into the plan. Again, there's no cost to you at all for any of that. with, again, the exception being 1650 of deductible if you're on the HSA plan. A lot of people hear this and they go, okay, why would we want to do that? Because it's free to us, but it must be costing the county a ton. It's actually a discounted rate to the county as well. So you're getting the best care possible and it's saving the county and you money. It's a bundled plan. And because it's going to these places that this is all they do or this is what they do best, they're able to do it quickly, they're able to do it efficiently, and they're able to do it at a lower cost with a bundled discount. For other serious conditions, and this is going to be probably maybe only 1 or 2% of individuals at companies, you guys have a plan available called Samaritan Fund. Um, the example I gave earlier about the child that's on a $90,000 a month medication, that child is a hemophiliac, so that's a condition that is significant and it's going to last for a very long time. And outside of those $90,000 in prescription costs, that child usually comes in at just under $1 million in claims every year. We were able to get that child moved over and the family onto Samaritan Fund. What Samaritan Fund is a charity organization that deals with specific medical conditions, healthcare conditions, and they have donors that, and most of the time it's philanthropists that donate significant amounts of money for specific conditions. So if you reach out to Samaritan Fund, they're going to again get a HIPAA form, they're going to get medical records, they're going to look and see if someone qualifies for this plan. They are then moved on to an individual medical plan that covers 100% of everything. So it takes away the worry from an employee standpoint of having to worry about deductibles, coinsurance, copay when you're already dealing with a very significant condition. So the employee, the child covered at 100%, there's no cost to you. The county pays a single one-time annual fee to move that individual onto that plan. And then again, it's white glove service for that. So most people listening to this are not going to qualify, not going to have a condition. But if you're listening to this presentation right now and you have something that is a significant condition, a very serious surgical issue where you're going to have multiple surgeries throughout the course of the year. Maybe it's a significant cancer diagnosis and it's going to require a lot of care over the next year. Any of those types of situations, reach out, fill out the HIPAA form. Jody can get it to you. It's actually a link. And then an advocate from Samaritan Fund will reach out and walk through to see if it's something that you could qualify for. If you do, you move on to that plan for a full year. So you come off of the county's plan, you go on to that plan, and then it's reevaluated annually. So if it's a situation where the condition resolves, then the next open enrollment, you would move back into the county's plan. Health savings accounts. So the HSA that I mentioned, the 3,300 plan, that does allow you to partner it with a health savings account. Think of a health savings account as a 401k for healthcare expenses. You can set aside money on a pre-tax basis into an account that you own. If you leave the county, you retire, whatever the situation is, that money goes with you. You can use that money on a pre-tax basis to pay for qualified expenses, deductibles, coinsurance, copays. If I have a child that's got braces, eyeglasses, let's say I have vision insurance, but I get eyeglasses and contacts, the plan only covers one. Any of those things are things that you can use your HSA dollars for. When you enroll, you open an account, you get a debit card, you then use that at your point of service to pay for the different things. If you get a medical bill, for example, you can then fill in that credit card information on the bill. If you're old school, send the paper back, or most of us would log on to the provider website, enter that debit card information, and pay the bill that way. The county puts a very nice contribution into your account when you enroll in the HSA 3300 plan. So they're padding your HSA or your health savings account right off the bat for you. A couple important notes where HSAs are concerned. You can't have other first dollar coverage. So, for example, if I'm enrolled in the PPO or the POS 250 plan here, and I cover myself, but then my spouse is enrolled in a medical plan at his employer, we could cover each other and have dual coverage and really boost our coverage, and there's nothing wrong with that. If I'm enrolled in the HSA 3300 plan though, and I have a health savings account, I can't have that other plan. That other plan is going to make me ineligible to contribute to my HSA here. Examples of first dollar coverage, flexible spending accounts, Medicare, TRICARE, VA benefits, Medicaid. If you're enrolled in any of those, you are not eligible to contribute to a health savings account. A question that usually comes up is, what if I've got an HSA, I've got money in it, but now I decide this year I want to go into the POS, the 2000 plan. What happens to my money? You can still spend it, you just can't put more in. So those requirements, the Medicare, the Medicaid, the TRICARE, that's all to contribute. So you can't contribute if you're enrolled in any of those. Another important note is with medical, dental, vision, you can have your child covered up until the point that they turn 26. Doesn't matter if they live with you, doesn't matter if they're a college student, they could even be married. If you want to keep them on your plan, you can. With a health savings account, that is a tax dependent. So you can only use your HSA for your legal spouse or a tax dependent. Most of the time, that's going to be up until the age of 19. My daughter, full-time college student, she's 21. I can continue to use my HSA dollars for her expenses because she's a full-time student. Once she graduates, though, I can't, or I just stop claiming her on my taxes, then I can't use my HSA for that anymore. No one is going to stand over your shoulder and make sure that you're using your HSA for appropriate things. Jody's not going to come up and say, "Hey, Trudy, I saw you made a purchase over at Walgreens for some Doritos." That's not a qualified expense. It's your responsibility to make sure that you're using that. If you use it for something that is non-qualified, and usually people say, "Well, the debit card's going to decline. How am I even going to be able to do that?" You have the ability to pull money out of an HSA. So if you said midway through the year, "I'm going to pull $1,500 out of my HSA account," you can. But when you go to file your taxes, you're going to be subject to regular income tax and a 20% penalty. So in order to make that money really valuable and get the value out of it, you want to make sure you're using it on qualified expenses. Any questions on HSAs? We're coming down to the last 4 minutes, so I'm going to be very quick in the next slides. This is the amount that the county is contributing to your HSA for the upcoming plan year. If you have single coverage, $1,160. If you have family, $2,320. The IRS maximums, what you can put into an HSA, if you have single coverage, is $4,300. If you have family, which is anything more than single, you can put in up to 8550. That amount is a combined amount of what the county is giving you and what you put in. It can't exceed those two amounts. The only exception to that is if you are 55 or older, you have the ability to put in up to an additional $1,000 if you choose to do so. I'm going to skip past the dental and vision. Nothing is changing on those this year. If anyone has questions afterwards, please let us know. I can walk through all of this and record it and have it where you guys can view it. I spent a lot of time on the medical, so I apologize. I really just wanted to make sure you guys understood it all. Nothing is changing on your life. Nothing is changing on your voluntary life. All of that is the same. A quick note on the voluntary life. If you have not elected this in the past and you're not a new hire and you want to elect it now, you can, but you're going to be required to fill out what's considered to be an E of I, or an evidence of insurability, the health questionnaire. They're going to ask you some basic health questions, and then Mutual of Omaha is either going to approve or deny, or they may reach out to you and ask for some additional information. If they do, don't get frustrated. They reached out to me and said, "We'd like to come out and draw blood and take your height and weight." They did it at their cost, at my convenience. They actually came to my home, and then they approved me. So keep that in mind. Don't get frustrated. But again, like the HSA, you are responsible for this. So if you're applying for an amount that you know you need the health questionnaire for, please make sure that you get that taken care of within 30 days of your election. We've got 4 voluntary benefits for you guys as well. Short-term critical illness and accident, nothing has changed on this. I'll quickly touch on the hospital indemnity since this is new. Hospital indemnity is a very basic benefit. It works like the critical illness and accident, where if you experience something, you pay for it or it runs through your medical plan. You then submit a receipt to Mutual of Omaha. You fill out a little claim form, it's about this long, and they cut you a check and mail it back to you or direct deposit it. This is for hospital and ICU admissions or stays. So you have a hospital admission. Let's say you go to the ER, you're having chest pains. They decide they're going to admit you to the hospital. There's a benefit paid to you for that admission. Then there's a daily benefit for each day that you're in the hospital. And I can't remember offhand what these are, but we've got a benefit summary that we'll get to you that will show you that. And then the same thing for intensive care units. So if you're admitted to the ICU, there's a benefit for that. Then there's a daily benefit as well. So this is helpful for any of the plans. It would really be helpful for those that have the HSA 3300, to help offset some of those costs as well. I'm going to skip through to the last one. So what do you need to do? Review your current elections. If you are not doing anything, you're not making changes, you don't want to take the new hospital benefit, you're happy with what you have, you're not changing your HSA election, you don't need to do anything. What you have in the system now is going to roll forward to next year. If you are making a change, go into Employee Navigator by midnight on the 16th. Make those changes. You are going to have to walk through all of the screens, but I think you can do it in about 7 minutes. It's not that long of a process. And then if you are increasing your voluntary term life or electing for the first time, make sure that you're filling out that evidence of insurability. There's a link. You can do it online. That's the easiest way. Or there's a paper form if you want to fill it out that way, and you can fax it or email it. Additional questions?
April, you're going to be here Monday. I think I'll just save my questions for you then, right?
Okay, yep, yeah, I'll be there. So we can just kind of step aside so that not
Yeah.
everybody's hearing them.
Thank you.
You're welcome. So I'm sorry I didn't get a chance to cover all the slides. Jody and Nathan, I'll do like a voiceover where I walk through all of the slides and record it and send it to you guys. And that way you have it for new hires, if that would be helpful, or for anybody that didn't attend.
Yeah, that'd be good.
Excellent.
Perfect. Any other questions at all from anybody else? Looks like we maybe only have one person online. Okay. If not, thank you for your time. I will bring I'll have that flyer when I come out on Monday that gives some high level stats of what's been saved from the McKenzie partnership. And then any questions that you guys have at all, I'll be there the whole time. So feel free to kind of pull me to the side and I can make sure we get them all answered.
Sounds good.
Thank